Hello and welcome to Ion Port. This program is proudly brought to you by the Ghana Community Network Services, the Ghana Revenue Authority, West Blue Consulting, Goyle Company Limited, as well as Serene Insurance Company Limited. Our media partner is the Business and Financial Times. This week, we are dedicating our program to the celebration of our frontline health workers who are helping prevent the importation and spread of the coronavirus through Ghana's seaports. But first, let's look at how Ghana's seaports have been handling the coronavirus since it broke out early this year. Ever since the outbreak of the coronavirus pandemic in the latter part of 2019, many have related the global public health adversity to the Spanish flu, also known as the 1918 pandemic. History reports that the 1918 pandemic viral disease had strikingly similar symptoms to COVID-19 and nearly wiped the entire planet, killing over 50 million people, far more than people who died during the First World War, and claimed an estimated 100,000 lives in present-day Ghana. Reports indicate that the disease was introduced into the then Gold Coast by shipping along the southern coast and overland across the northern frontier. Therefore, it was not surprising that many countries closed their border frontiers to human and vehicular traffic when COVID-19 broke.
All our borders, that is by land, sea and air, will be closed to human traffic for the next 2 weeks.
However, cargo traffic still remained opened.
This closure will not apply to goods, supplies, and cargo.
International cargo trade is predominantly by sea, with the ports of Ghana being responsible for over 80% international cargo trading. With a history of the devastating record of the 1918 pandemic on hindsight, the ports of Ghana have been extremely cautious ever since in its protective measures against being used as conduit to importing and spreading viral diseases of significant magnitude like Ebola and COVID-19. In 2014, significant efforts were made by Ghana's Ports and Harbours Authority to implement all the best strategies in order for Ghana not to record any cases of the Ebola. The Port Authority equally undertook measures including training and sensitization as early as January and February 2020, with both onshore and offshore restrictive measures to avoid any importation of COVID-19 cases, although cargoes were being received through the ports. The Port Authority also banned the receipt of cruise or passenger vessels, among others. It appears all these measures have paid off, as no case has so far been transported through ships and the ports to Ghana as of date. Still on the COVID-19, Ion Port took its lenses closer to one of the GPHA health facilities to observe how the GPHA Health Services Department has been fighting the coronavirus.
Onshore, the health and medical team of Ghana's Ports and Harbours Authority are still leaving no stone unturned. The team has been playing a key role in the dispensation of health services during this period of COVID-19. Ghana Ports and Harbours Authority has 4 main health facilities: the GPHA Hospital in Takrade, the main GPHA clinic located in Tema Community 2, and the GPHA clinic annex located within the port operational areas that handle first-hand emergencies. Additionally, GPHA recently completed its fully state-of-the-art International Maritime Hospital with modern and top-class medical equipment, wards and facilities, and a helipad for emergency helicopter ambulance services. All the medical and health facilities operate a 24-hour services, providing top-class healthcare delivery to the port community, people of Tema, Greater Accra region, and Ghana as a whole. The GPHA clinic is not currently a designated treatment center, but continues to interface between generally sick patients and their families who could be potential carriers of the coronavirus. Ion Port gained exclusive coverage of the dealings within the GPHA clinic associated with COVID-19. The clinic ensures that all clients, staff, or visitors upon entrance of its facilities observe hygiene protocols, including washing of hands thoroughly under running water and the usage of alcohol-based hand sanitizers through automatic dispensers. Special screening of all patients on COVID-19 parameters is done to ascertain their status for effective isolation if they need be. Isolated patients who either show symptoms of COVID-19 or have been exposed to COVID-19 infected patients are taken to a holding area, which is restricted, where patients are detained and testing is done. According to Dr. Roland Dakpala, a senior medical doctor at GPHA, supportive treatment is given to patients who demonstrate symptoms that require attention in order to stabilize them until results are confirmed.
If we suspect a case and we have moved the case to our holding area, we just come and pick it as a set and then send it to our holding area for management of the symptoms till the results come.
GIDEON LAMPTEY'S, a medical laboratory scientist, took the team through the procedure of sample taking.
So there are times that some don't have the sputum, the nasal sample, so we take the sputum if they can produce the phlegm for us.
He hinted a high probability of expanding the holding area should the number of reported cases and other infectious diseases increase.
We are planning into the future. Once COVID is there, it's not only COVID. These diseases of public health concern, they are always coming. So once you have and you plan for that, it makes it easier. It also protects we, the healthcare workers.
Dr. Roland Dakpala said all these procedures by health officials are done with strict adherence to the proper use of the personal protective equipment. He added that regular fumigation of the holding areas and other areas of contact in the clinic facility is done to the contagious nature of COVID-19. He emphasized that COVID-19 is not a myth, so the general public should comply with all safety protocols announced by health authorities.
We will still continue to advise strongly that every citizen still continue to take their infection prevention measures.
The matron nurse of the GPHA clinic said even though they could not celebrate the week-long World Nursing celebration, they will continue to play their key role in taking care of the general public against the COVID-19. She also expressed worry over stigmatization against nurses and frontline officers during the period of the COVID-19.
If you have your nose mask, your gown, with your full PPE, there's no way you can contact the disease.
This is the entrance of the holding area, which is an area designated to take samples from suspected cases. And then in here what happens is that when you come, you sit, and then the medical laboratory scientist in the person of GIDEON LAMPTEY'S would have to take samples of the suspected case and then take the samples to Noguchi, and the results we are told would arrive within 24 to 48 hours, which means that latest by 2 days they expect that the results will be in. Reported from the GPHA main clinic in Tema, this is Solomon Anderson.
Let us take a listen to the life of GIDEON LAMPTEY'S, one of the frontline health workers who has been risking his life on a daily basis to help prevent the importation and spread of COVID-19 through Ghana's seaports.
Can you imagine having to be in close contact with the dreaded coronavirus on a daily basis? Imagine the anxiety that could be associated with whether or not you have been infected with COVID-19 due to the nature of your work. Imagine having to continually observe the strictest level of precautions against COVID-19 in your everyday life. Unlike most people, the slightest mistake on your part does not only endanger yourself and immediate contact, but can severely jeopardize the outcomes of someone's health diagnosis. That is the life of GIDEON LAMPTEY'S, a senior medical laboratory scientist at the Ghana Ports and Harbours Authority's clinic. GIDEON is 38 years and married with 3 children. He's a native of Jamestown, British Accra, and an alumnus of the School of Allied Health Sciences, University of Ghana, and the University of Liverpool, where he gained higher learning. GIDEON is a fellow of the West African Postgraduate College of Medical Laboratory Scientists. He has been at the very front of coronavirus-related interactions since the outbreak of the pandemic. On an average day, he plays a key role in the diagnosis of medical conditions at the GPHA clinic. But now, He plays a much more crucial role in the case management of COVID-19 at the GPHA clinic. Gideon has been pivotal in the screening of crew members during the arrival of vessels at the Tema port in these times of preventing importation and spread of the coronavirus.
When desperate times called for desperate measures, so as we were working to, we know that the port is also an entry point. So we quickly have to do what needs to be done to ensure that our clients that access our ports here are protected.
The medical laboratory scientist described the difficulty of participating in port activities, but emphasized how he needed to adapt to enable him contribute efficiently to the fight against COVID-19 at ports of Ghana, which is considered a major avenue to importation of the disease.
I had the training, in fact a very, very short training from the harbour master, Captain Yeboah, and also he assisted me, one Captain Gakpe. So they will give me on tuition, basic tuition on what to do in order to go and climb a monkey ladder. Of course, I have no swimming experience, so it was just sheer bravery.
Gideon has also been crucial in the sensitization campaign the Medical Services Department of GPHA embarked on prior to and after the confirmation of positive COVID-19 cases in Ghana. He reviewed the challenges associated with convincing patients to collaborate by offering the right information and assistance.
There is no stigma about this COVID. You see, there are many times that you would even go to a contact house to go and take the sample. Immediately you leave there, the whole area will come and tell you that they say this man has it.
Gideon Lamptey has worked in his medical field for more than a decade and has previously served in the Liberia Treatment Center during the Ebola pandemic. Being a family man, Gideon is keen on his personal protection and, in addition to strictly following the health protocols, has already tested on 3 occasions to ensure he is not infected with the coronavirus.
Now to our main discussion of the week, which is celebrating frontline health workers in the fight against COVID-19 at Ghana's ports. We engaged 3 key personnel of GPHA'S Health Services Department to delve deeper in their dealings as frontline health workers at Ghana's ports.
The General Manager of Health Services Department of the Ghana Ports and Harbours Authority, Dr. Vitus Victor Anabisi, has revealed that no case of COVID-19 has been reported through ship or sea transportation, and for that matter, Ghana's sea ports. He attributed this success to rigorous efforts that have been instituted at the seaports of Ghana by the Port Authority in collaboration with partner stakeholders, including the Port Health Unit of the Ghana Health Service.
When we had this pandemic, we didn't even wait for the day WHO announced that it's a pandemic.
Yeah.
We started our education, as you are aware, the awareness program. We started way back in January, where we went together with your crew, the Iron Port team, together with Port Health. We went around all the stakeholders in the port community.
Dr. Anabisi's revelation has become more essential considering the fact that ever since the outbreak of the coronavirus pandemic in the latter part of 2019, many have compared its devastating effects to the 1918 Spanish flu pandemic, which is reported to have been introduced into the then Gold Coast by shipping and sea trade along the southern coast and overland across the northern frontier. Speaking on Iron Port's live panel discussion on fighting COVID-19 at Ghana's ports and celebrating the frontline health workers, Dr. Anabisi revealed the various strategies that his outfit has undertaken to ensure Ghana's seaports are safe from the importation and spread of the coronavirus to protect the port's role as major economic assets for the state.
Indeed, we spend, because we have to indeed support government. We have to also help to do what? To keep our staff and our business going. If we do not keep our ports safe and the ports closed down, if Tama ports or Takoradi ports close down today, I think Ghana will grind to a halt.
He said the Port Authority has put in place new strategies such as the mandatory health declaration forms that were introduced to ensure that seafarers who use Ghana's seaports were remotely monitored.
We designed a quick declaration form on our own called the COVID-19 declaration form for all vessels. And we had them distributed to every shipping line and all clearing agents. That indeed, before a vessel will call at our port. They will have to fill that form and send to us by email. Answer certain critical questions, key questions concerning COVID. And this is supposed to be done 7 clear days before the vessel arrives.
Dr. Knapp said the management of the Port Authority, despite financial constraints, recognized the desperate times the country faced and played a key role in procuring all the needed equipment needed to augment the health services capacity to ensure the port's clients and operators within the port community are protected from the importation and spread of the coronavirus. A senior medical laboratory officer at the GPHA clinic, GIDEON LAMPTEY'S, on the same program recounted some of the undesirable behaviors sections of the public demonstrate during the taking of samples for onward testing.
One particular case that went to Ashaman to go and take the sample. I was there immediately. We finished taking the sample. We're droning off. We tried to minimize public exposure. But yes, so somebody had the nerve to be videoing us, and I was really sad.
He called on the general public to desist from the stigmatization of health workers in particular in order not to demotivate them to stop serving the public against the spread of the COVID-19.
I want to take this opportunity to continue to appeal to them that it doesn't help because we are fighting for God and country. We are putting our lives at risk, and we want them to appreciate us when we come home, when we sit with them. They shouldn't talk about this. They should rather encourage us to do more. Because if we don't do our work, it ends up continue to increase the case base that we've been having so far.
GIDEON also emphasized on the need for regular testing on the part of the frontline health workers due to the delicate nature of their work. A nursing officer at the GPHA clinic, Regina Efwatideku, also lamented the psychosocial impact stigmatization will have on the Ghanaian society and added her voice for its eradication.
If you shove the person and you isolate the person, then this can push the person into depression. And we know the dying consequences that depression comes along with. So we want to appeal to the general public that by the grace of God, if somebody recovers from coronavirus infection, we are not saying you should go embracing the person, but accept the person cautiously.
Regina Tideku, also a fellow of the West African College of Nurses, called for corporate organizations and benevolent enterprises to support governments with the provision of logistics, especially personal protection equipment for nurses and other frontline health workers, as she shared some experiences.
We are pleading with our authorities, our employers, to provide us with the PPEs so that no nurse will be said that refused to attend to a patient because he didn't get the necessary protection. We are also humans. We have families who depend on us, and we wouldn't want to contract diseases and conditions as consequence of we trying to give off help to other people.
She bemoaned that many frontline health workers, especially those in less privileged institutions, are woefully exposed to the virus during their service, and their protection should be treated as an immediate priority.
This is a great burden. It cannot be carried by the government alone. All other people who can support should come on board so that we give the necessary protection to the nurses so that they can stand this war front.
GIDEON LAMPTEY'S, the consultant medical laboratory scientist, on his part, called for more infrastructural support in terms of labs and equipment at the national level to enable increased efficiency in carrying out their duties as the virus continues to spread in the country.
In addition to looking at the scenario, the testing, now it's only Noguchi and KCCR and a few other peripheral laboratories that are doing the test. But when you look at the Western world, there are a lot of laboratories. They are testing it all over. So what can be done? There's a lab policy there that needs to be followed. We want to urge government to quickly put in place to ensure that we have more than Noguchi Institute in the country.
And the cases here.
Yes.
Dr. Anabisi also stated that on the global level, countries would have to expand and invest in sufficient state-of-the-art facilities that can contain such public health emergencies.
We even recently made a proposal to, again, the EU. I personally asked that we should look at building for a state-of-the-art innovative center dedicated for infectious diseases in the port, because this might not be this certainly will not be the last pandemic we'll get in this world.
He explained that mass testing, especially in institutions, may not prove to be useful in stemming the spread of coronavirus.
I would say that there's no need to test everybody en masse. It's not necessary. Why? Because you can test somebody today, tomorrow he'll pick the virus. What happens? What have you done? Are you going to be testing everybody every day? So that is why we categorize people. We have high risk people, medium risk, and low risk.
Okay.
So if you look at it, if the person is not a suspected case, if the person is not a contact, why do you test the person?
Okay.
In any way, I mean, this is public health, and of course, resources must be used prudently.
The respected medical doctor, however, encouraged stricter adherence to health etiquette as well as effective contact tracing as a more reliable strategy in containing the COVID-19. The panelists urged their colleagues serving as frontline health officials to embrace the call to service in these challenging times to demonstrate their very purpose in life.
I want to say to my colleague nurses that they should remain resolute in the call of our vocation that we find ourselves in. We have been trained to give care to everybody irrespective of a race, color, political or social status. We should continue in that regard.
Eye on Port returns after this break.
Here's innovation from GOIL that takes you further. New GOIL Super Synthetic 5W20 and 5W30 lubes have been expertly crafted with the latest in liquid engineering technology, highly advanced for modern engines, prolongs oil change intervals, save you fuel, clean, protect and enhance engine performance. The way engines work has become complex, and GOIL has innovated to stay ahead. Expertly crafted lubricants that work excellently with all petrol and diesel engines of today. New GOIL Super Synthetic 5W20 and 5W30 lubes. Innovation that takes you further. GOIL. Good energy.
Dear valued client, the Ghana Trade Hub mobile app is now live to make it easy to track your consignment and know the estimated duty payable for both general goods and used vehicles. We are pleased to inform you that the Ghana Trade Hub mobile app is available for download on Google Play Store for Android users and the App Store for Apple users. The Ghana Trading Hub mobile app is now live. Download and never be cheated. This is powered by the Smart Ports project under the auspices of the Government of Ghana and the Ghana Revenue Authority. Smart Port, improving Ghana's ease of doing business.
Electricity, then pay your taxes. Our taxes, our future.
Because you see, without our taxes, we wouldn't have good roads, good schools, better hospitals, street lights, and other very important social amenities. When we pay our taxes, we give our children free and quality education. Talga, my money too small. Why should I pay my tax? Look, small. Salifo, it doesn't matter how small or big your business or income is. You still have to pay your taxes. The little taxes from each and every one of us, when put together, could give your community clean water or that deprived school with tables and chairs. Please pay your taxes. It is your responsibility. It is your civic duty. It is the law.
Oh, how are you?
Hi Yvonne, a few words please. Everyone is talking about the fire at your production house last week. How are you holding up? Has production stalled?
No, not at all. My crew and everyone on my set is perfectly fine because I insure with Serene Insurance. As a matter of fact, I've had all my equipment replaced, including the vehicles that were affected. My workers have been sorted out. Even my production downtime has been covered. So it's all good. I have a meeting to attend to, so I have to get going. Sorry about that.
Which insurance company did you mention?
Serene Insurance, the new face of insurance, a member of First Sky Group.
Let's take a look at some international port news happening around the globe. Seven people died after an Aframax tanker undergoing maintenance at a shipyard in Indonesia caught fire on 11th May 2020. The Directorate General of Sea Transportation of the Indonesian Ministry of Transportation said the fire broke out on board the 105,100 deadweight tonnage Jack Leela, docked at the Belawan shipyard in Sumatra. It was reportedly preceded by several explosions on board the vessel. Local agencies managed to extinguish the fire in a joint effort later that day. However, thick smoke was hampering rescue and evacuation attempts. On 12 May, a police report revealed that there were 60 workers on site at the time of the incident, of which 22 sustained injuries and 7 were declared dead. German shipping major Hapag-Lloyd felt a negative impact of higher bunker prices in the first quarter of this year as it reported lower earnings. In the first quarter of 2020, Hapag-Lloyd's bunker cost increased by $98 to $523 per ton as a result of the transition to low sulfur fuel oil. Consequently, the company's transport expenses rose by almost 10%. As explained, this had a negative impact on earnings, as did a devaluation of bunker inventories of around $64 million due to the rapid decline in crude oil prices that began at the end of the first quarter.
Here's innovation from Goyle that takes you further. New Goyle Super Synthetic 5W20 and 5W30 lubes have been expertly crafted with the latest in liquid engineering technology, highly advanced for modern engines, prolongs oil change intervals, save you fuel, clean, protect and enhance engine performance. The way engines work has become complex, and Goyle has innovated to stay ahead. Expertly crafted lubricants that work excellently with all petrol and diesel engines of today. New Goyle Super Synthetic 5W20 and 5W30 lubes. Innovation that takes you further. Goyle. Good energy.
Oh, how are you?
Hi Yvonne, a few words please. Everyone is talking about the fire at your production house last week. How are you holding up? Has production stalled?
No, not at all. My crew and everyone on my set is perfectly fine because I insure with Serene Insurance. As a matter of fact, I've had all my equipment replaced, including the vehicles that were affected. My workers have been sorted out. Even my production downtime has been covered. So it's all good. I have a meeting to attend to, so I have to get going. Sorry about that.
Which insurance company did you mention?
Serene Insurance, the new face of insurance, a member of First Sky Group.
It's time for the schedule of vessels in the port, those at anchorage and those expected in the coming weeks, plus the Bank of Ghana exchange rates, which you need to know to clear your cargo with. This brings us to the close of this edition of Eye on Port. Thank you for watching.